Hi there, you're welcome to DamiRx Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube. Also, you'll be able to support us here on our YouTube channel by hitting that like and subscribe button. And also, as a gift for you for subscribing to our channel, you can hit the link down below in order to download a free healthy meal recipe that we do have here on DamiRx Care. Thank you and bye-bye. Hi there. So what is our medication of choice today? Our medication of choice today is going to be Flonase. So Flonase also has a generic known as Fluticasone. So Flonase is a steroid inhaler that's used in most patients in order to help with allergies as well as asthma. So how do patients use it when they have allergies? So patients can take 1 to 2 sprays in each nostril once a day, and once that symptoms start decreasing, then you can decrease it down to about 1 spray once a day. For patients who have asthma, you want to take about 1 to 2 sprays in each nostril once a day, and this medication usually comes in another form which is known as the annuity ellipta. So this medication comes as a nasal spray, as you may already know. And what are some of the side effects of this medication? So some of the side effects of the medication include headache. This medication can also cause backache. It can cause nose bleeding, most especially if your nose is very dry. It can also cause cough as well as throat pain. As you may know that when you're spraying something inside your nostril, it kind of drains into your throat, so it can kind of cause throat pain or throat irritation. And also some patients have noticed fever with this medication. So with these symptoms, they're not all inclusive, so patients may or may not have these symptoms. It really just depends on how well your body tolerates this medication. So this medication is a steroid inhaler, and there are some contraindications, which is there are some patients who should not be taking this medication. So if you do have an acute asthma episode, this is not the right time for you to take this medication, as this medication may take longer for it to work or for the action to start kicking in for it to help with that asthma episode. So it is recommended to take the albuterol inhaler instead if you do have asthma. Also, if you have any hypersensitivity whatsoever to milk products, this is not going to be a medication of choice, as your body may react to this medication. So what do you want to know about this medication? This medication works greatly for patients who have allergies. I've tried it before and it has really helped with allergies, whether it be pollen or maybe some patients who just have seasonal allergies all throughout the year. When the weather changes, this medication will be a great medication to try in order to help with those allergies. So you want to make sure that you shake this medication very well before use, as you know that this is a liquid solution in order for the medication to be well mixed in before you apply the spray. So for the first time when you're trying this nasal spray, you want to make sure that you're priming the bottle before use. So what does priming the bottle mean? So you want to spray out about 6 sprays into the air before inserting this in your nostril and spraying it up your nostril. Also, if this medication bottle is left unused for about 30 days, or maybe you left the bottle of the cap open or for about 5 days or more, then you want to make sure that you're priming this bottle as well before you use it. So don't forget, you want to make sure that you're spraying about 6 sprays outside in the air before you place it in your nostrils and spray it. So, like I said earlier, this medication is not for patients who are having an acute episode of asthma. So these patients need a medication that's going to open up their lungs faster, which is going to be the albuterol. So the albuterol is going to serve as the rescue inhaler in order to help these patients. However, there are some asthma patients that do use this on a long term as a maintenance medication in order to help keep their asthma controlled. And as I said earlier, this medication medication does take time to work. So this is not a medication that you want to see that you're going to see the effect immediately once you start using it in patients who have asthma. Also, with this medication, you want to make sure that you're using it the same time every day. So this medication is a once in a 24-hour medication. So you want to make sure that you're being consistent in terms of when you're using it. That way you're not using it way lesser than that 24-hour period gap that you're supposed to give it. Also, in patients that have a history of fungal infection, this might not be the medication of choice, because this medication, as I said earlier, is a steroid inhaler, and usually steroids are known to increase patients' risk of having an infection. So if you have a risk of having a condition known as candidiasis, this is not going to be a medication of choice for you. Or if you do end up using the medication, you want to make sure that you're being careful, and if you start seeing any reoccurrence of that infection, then you want to make sure you stop it and reach out to your doctor immediately. Also, in patients who are using this steroid inhaler for a long time period, this medication can affect how well your wound heals. So patients who are known to use steroids usually have a more slow healing process anytime they have a wound, and this is usually recommended. That's one of the reasons why we have patients kind of use the steroid for a short period of time. That way they don't start seeing this side effect. Also, with this medication, it may slow the growth in children, especially children that are using it as a long-term medication for asthma control. So you want to make sure that you're reaching out to your doctor if you're noticing any growth stunt in your child. Also, with this medication, another side effect for patients who are using it long-term is it can cause low bone mineral density, which are all side effects that are attributed to the medication being a steroid. With this medication, if for patients who are using this as a long-term medication for asthma as well, you want to make sure that you're checking with your prescriber before taking any vaccine, which are known as a live vaccine. So these vaccines will be known as your chickenpox or measles virus vaccine. So you want to make sure that you're reaching out in terms of taking live vaccine if this is an appropriate vaccine if you are going to be on this medication long term. All right, I hope I was able to help with one or two things to look out for while you're on this medication. If you have any questions, feel free to post them down below. Also, we do have a medication consultant who's willing to help you as long as you go on our website, which is www.damierxcare.com. And that will link you directly to a medication consultant who can give you more information regarding this medication and how to use it properly. I hope you were able to enjoy this video. Once again, if you do enjoy watching this video and you would like more, make sure you hit that subscribe button. That way you can get alerts anytime we post our other educating videos here on YouTube. Thank you.